Osteoporosis is a condition where our bones become less dense and therefore more likely to fracture. It's sometimes called the silent disease because you typically don't have any symptoms when you're losing bone mass, and it's not until you fracture that this kind of becomes a problem. So some people will go on without realizing that they've got osteoporosis until a small trauma like a little fall or a bump actually results in a fracture for them. Osteoporosis can affect anyone, but it typically affects those who are in their older ages. Women are more likely to get osteoporosis than men, and there are two main reasons for that. Women typically have a smaller skeleton to start with, so their bone stores are typically less to begin with. And number two is that once women go through the menopause, they have a change in their hormone composition. Estrogen in particular really drops off, and estrogen normally plays a really big role in bone health. Osteoporosis can affect men too, and this is often in relation to a decline in testosterone. There's less understanding about why maybe men have a reduction in testosterone, but we do know some factors that can influence it, and they can involve sort of smoking, excessive alcohol consumption, or prolonged steroid use. Elite athletes can sometimes develop osteoporosis later on in their life as well. So particularly in sports where aesthetics is important, with gymnastics maybe. Sometimes we pick these up because athletes will present with things like stress fractures. In females, they might have menstrual dysfunction, but it's important to note sort of if athletes are having any issues with eating behavior disorders as well, and we can pick these up. So if you or your GP suspects that you might have some loss in bone density, they're going to refer you through to a specialist to have a DEXA bone density scan, and as part of this you will receive something called your T-score. Your T-score can help to tell us whether you have a normal bone makeup, whether you have osteopenia, or whether you have osteoporosis. And the important part about knowing that is that it helps us, along with other factors, it helps us to determine your risk of fracture. If you have osteoporosis, there are some things that you can do to make sure that you continue to keep up as much bone mass as possible, to continue to keep fit and active, to keep strong, and to make sure you keep up your balance. So things like eating a well-balanced diet are going to be important, and in particular from a physio perspective, we're really interested in keeping you active, keeping you strong. Resistance training in particular can be really helpful for those who have osteoporosis, as your bones are living structures. They respond to stresses that we put on them throughout the day, and resistance training can really help to put a bit of load through the bones and can help to slow down the bone loss that can happen. When we are young, when our skeletons are still growing, it's important that you're getting lots of impact training. So encourage your teens to get outside, to run, to play tennis, to play football, basketball. All of those things are really important for building up our bone mass and our bone stores. Once we hit about 30, we reach our peak bone mass. And from there, we notice a steady, slow decline in our bone mass. This is okay, this is normal. The important thing is that exercise can be used to help to slow down this bone loss, as well as doing things like eating really well, avoiding cigarette smoking, avoiding excessive alcohol intake, getting plenty of sort of vitamin D, so soaking up all those rays, or taking some supplements if you're in the UK throughout wintertime. Osteoporosis itself is not painful and is often sort of asymptomatic. It's not until you have a fracture that things can change. Fractures can be quite disabling and can really affect people's quality of life, particularly as they get older. You absolutely should include balance exercises within your training. We can, for a lot of people don't know, but we can actually retrain balance. And it's really important, particularly if you are at higher risk of fracture, that we minimize those chances of falling. If you work with a physiotherapist, if you work with a trainer, get them to include some balance exercises within your program. If you have any questions or concerns regarding osteoporosis, please feel free to get in touch with us here at Complete Physio. We're more than happy to sort of answer any of your questions, and we look forward to seeing you soon.